Good morning, everyone, and thank you for inviting me to speak today. I want you to meet baby Jay. He was born 2 years ago with a condition known as gastroschisis, in which his intestines were developed outside of his body. On his first day of life, he went to the operating room and was found to have a large portion of his intestines were dead. They had to be removed. As a result, he only had 5% of his intestines remaining, and he spent the next 4 months in the NICU trying to be fed, both orally as well as through a gastrostomy tube. But despite multiple measures, he continued to have feeding intolerance. He would have multiple episodes of vomiting. In addition to that, because of his short gut syndrome, as well as his poor absorptive capacity, he would have multiple episodes of watery stool. It was clear that this child was going to require IV nutrition for months to come. Now, baby Jay is like 30,000 other children in the United States who are TPN-dependent. And with using our regular TPN regimen that we've had in the United States for the last 40 years, including both protein, glucose, as well as intralipid, it is known to cause some problems. It does provide them with the opportunity to grow, but that they're a higher risk of developing infection, metabolic disturbances, as well as organ dysfunction. But the most serious complication associated with with TPN is parenteral nutrition-associated liver disease. This is known to be multifactorial in etiology. However, there is one particular component that we do know to cause multiple issues as far as with respect to the liver disease, and that is the intralipid. It is a soy-based formula that contains omega-6 fatty acids. It also contains phytosterols, which is a type of cholesterol. That is known to accumulate in the liver, and the intralipid is also known to cause an increase in inflammation as well as an increase in free radicals. And with that, it does cause an increased risk in developing fatty liver and also an increased risk in developing poor flow of the bile, thus causing an increase in cholestasis and causing the children to turn yellow. With TPN continue to be administered, the children that are at a higher risk of developing scarring and fibrosis and ultimately cirrhosis. As a result, 1 in 5 children will develop end-stage liver disease and require a liver transplant. So clearly, we do need a different regimen for these children in order to allow them to live longer while they are TPN for months or even years to come. And that actually started being performed. There were studies back in 1997 where scientists were focusing on rats, and they started administering a different formulation, which was fish oil-based and had omega-3 fatty acids. They found when they administered this to the rats, they found that there was an improvement in the inflammation and thus actually improving and slowing the progression of the parenteral nutrition-associated liver disease. In addition to that, there were further studies that were done that actually even showed reversal of the damage being performed. Further studies had been done that also showed that there was an improvement in the bile flow, and thus those kids had a decrease in their cholestasis as well. This came actually into clinical practice in the early 2000s for a child who was actually being taken care of at Boston who was TPN dependent but had a severe soy allergy. Thus, he couldn't get the intralipid that we typically give to our children. He was fortunate enough to actually get Omegaven, and I will let you know that this product is not commercially available in the United States, nor is it FDA approved here. So you're only able to get it under research protocol and with specific approval through the FDA by getting forms completed. And actually, Boston is not the only institution that has it available. We have it right here at Stony Brook, and we have patients who are fortunate enough to be able to get it through us as well. Now, I should also let you know that we are also purchasing it directly from the pharmaceutical company located in Hamburg, Germany. And because of that, everybody who comes to the United States needs to go through the gates of JFK in order to get through New York. Unfortunately, our Omegaven actually had difficulties and forgot their passport and were held up at customs at JFK. Fortunately, we actually had the paperwork in order to release Omegaven, and they arrived to Stony Brook safely. Now back to our child, baby Jay. As he was started on TPN, you can see that his bilirubin levels started to rise. But once he was able to meet criteria to receive Omegaven, his bilirubin levels started to decrease and subsequently normalized. And they've continued to do so to this day. Now, because of that, this child has continued to thrive and grow and is doing quite well. So the next time you are in the NICU and you have a child who you're taking care of, who you know will be on TPN for months to come, think about the utilization of Omegaven and provide that child with the opportunity to slow the progression of their parenteral nutrition-associated liver disease. I want to thank Dr. Chawla, who served as the driving force for this program, and Dr. Abel, who's jumped through hoops in order to get Omegaven here. Thank you.